This female patient, age 44, who was operated upon for some mass relating to the pancreas 9 months back. No histopathological findings are provided, and we have to evaluate the pancreas. Now what you are seeing in front of your screen is in fact the body of the pancreas in transverse section, in the center of which you are seeing the duct. I will label it for you just a minute. Let us get a good view. Now you see, this is the body of the pancreas, this is the tail of the pancreas, this is the splenic vein, this is the superior mesenteric vein, this is the outer surface of the pancreas. So the the body of the pancreas is normal. This is the stomach, you can see the bowel shadows, and this is the liver. She is also suffering from chronic liver disease due to hepatitis C. Now you see, this is the pancreas, and no pathology is seen relating to the pancreas. Now I would like to see it from the region of splenic view, to see the tail of the pancreas as it approaches at the region of the kidney, left kidney. So let's see if we can get that. Here we are. Now one has to be sure that the area that you are seeing is not bowel, and is really the area that is that you want to study, and that is the tail of the pancreas. Now in this view, I can show you only this much, that this is the pancreatic tail, this is the kidney in transverse section, these are the central sinus echocomplex, the aorta. Now this is bowel. We should not mislabel this area as the pancreatic tail. These are bowel. This is a bowel, and the stomach with the internal gas shadows. So nothing significant as we go further and study the pancreas. She has been operated upon, but as I don't have any lab profile or any operative surgical notes, so I have to rely on all what I am seeing now. What I am seeing is that the pancreas is normal, that can be seen. This is the pancreatic band, white band of tissue is the pancreas, and rest all this is the bowel. This is the bowel, and this is splenic vein that you are seeing as a landmark for the pancreas. This is the aorta, and this is the superior mesenteric artery in transverse section. Now let's see if we can study the head of the pancreas. And this is the longitudinal section in which we are seeing the aorta, and we are seeing the origin of the celiac axis. And now I wish to see the origin of superior mesenteric artery from the aorta. From that region, actually one gets a better view of that of the this is the superior mesenteric. This is the superior mesenteric artery, this is the celiac axis, this is the celiac axis, and can we see the head of the pancreas? Now this is the head of the pancreas. This area is the head of the pancreas. This is the duct. This area. This tiny area, tubular area, is the duct, in the head of the pancreas. The head of the pancreas is unremarkable. No pathology seen relating to it, measuring approximately 2.3 centimeters with this depth seen within the center, and there is no dilation of the duct. There is no focal mass lesion, no calcifications are seen relating to the pancreas that we could have seen, that we have seen so far. So now when I move the probe, angle the probe about 60 degrees, I see two well demarcated hypoechoic areas, anterior and posterior to the common hepatic artery. Now this is the aorta. In fact, this arises from the celiac axis, common hepatic artery, and this structure and this structure. These two structures are the enlarged lymph nodes that we label as paraceliac lymph nodes. So there are two lymph nodes seen, and these are called paraceliac lymph nodes. And here you see the lymph nodes. Now, why do we say that this is a lymph node? Why not something else? Let's say this area and this area. Now keep an eye on this area, on these areas. I am going to give a sweep to the probe, trying to keep them in the center, and I would like to see that whether they change their shape or they remain the same, retain their shape. You see, they do not change their shape, they remain the same. And now again I am giving a sweep. They retain their shape. So these are lymph nodes, two lymph nodes that are seen. One, this is the common hepatic artery, and this is the lymph node number 1 anterior to it, and this is the lymph node number 2. This is the aorta, and this is the IVC. The gallbladder has been surgically removed, and you can see this is the portal vein. This is the portal vein, normal. However, the liver will show you coarseness with diffuse increased parenchymal echogenicity. This is the portal vein, and see the texture of the liver. Well, this is the portal vein. This is the common bile duct, and see, this is the duodenum. In this region we see the gallbladder. It has been operated upon, surgically removed because of some procedure on the pancreas. Primary pathology, as per verbal narration of the patient, that she had, they say that she had some mass relating to the pancreas, for which they attempted surgery, and now she is here for pain in the epigastric region, which is mild, persistent, and pyrexia. She is having pyrexia also. So the only finding so far that could be seen in this patient is two enlarged lymph nodes at the paraceliac gland, spleen normal, no pleural fluid, no para-aortic gland lymph nodes, no ascites seen. Hepatic veins are seen clearly. The bowels in this region are seen mildly dilated. This is the stomach, and this is the enteral region, enterum of the stomach. No adenopathy is seen in any other region. This is the caudate lobe. This is the ligamento venosum. No evidence of intrahepatic bile duct ectasia in this patient. However, she had hysterectomy 1 month back, and what we see down here is a cystic mass relating to the vaginal stump, as you can see in here. Now, this is the vagina. This is the vaginal stump that was not tightly ligated, and we see cystic and solid, predominantly cystic mass, because you see posterior wall acoustic enhancement, and these are echogenic areas with an inflocalcification or solid element is seen. This is the bladder, urinary bladder. This is our case of study.